In July, in July 2015, I stood in front of a packed auditorium in the South Bronx. People were wedged shoulder to shoulder, all sitting on folding chairs, and another 100 or so crowded the hallway. People were trying to squeeze in. I come there to talk about facts. What I didn't realize until later was that they had all come there to talk about justice. That was the night I learned that in public health, relationships always come first and facts come 2nd. Mm-hmm. The town hall had been organized by the Bronx borough president to discuss a large outbreak of Legionnaires disease. Legionnaires disease is a severe pneumonia. It's caused by a bacteria that can grow in the water. One of the common sources of this is cooling towers. These are these large metal structures that sit on top of rooftops, and they blow a visible mist into the air. Now, that mist can also carry bacteria that can travel for hundreds of yards, sometimes even miles. And this outbreak had already sickened dozens of people in the South Bronx, and there were more people being hospitalized every day. So I sat in the front of the room, and I felt prepared. I was wearing my favorite suit. It was a charcoal gray Ludlow type suit from J. Crew, kind of the type that our new mayor-elect likes to wear as well. Um, it wasn't the most appropriate suit for a hot summer night, but it felt appropriate to me. I wanted to project authority. I wanted to project credibility. I wanted to appear trustworthy. And I also carried with me the tools of the public health trade. I brought with me maps and figures. And most important, I had the confidence that the best epidemiologists, microbiologists, environmental health people in the city had collected the data, they had crunched the numbers, and using all of that information, we had contained the threat. And I believe that if I explained that data clearly enough, then people would leave this meeting reassured. And that's not what happened. um, so I started my presentation the way I trained at CDC. You know, first you describe the disease, what causes it, how is it transmitted, how do you cure it. Then I described our investigation. I showed a map of all the cases, and I showed how, when you look at that map, it really shows that everything localizes to this one area, and there's a pattern there about things flying through the air. And I told the room that we had identified several contaminated cooling towers in their neighborhood. We had ordered all of them cleaned, and we were quite confident that one of those cooling towers was the source of this outbreak. The air, I told everybody, was now safe to breathe. When I stopped talking, I scanned the room. People's heads shook from side to side in disagreement. They turned to their neighbors and scowled. Hands shot up. People started shouting over one another. And I was suddenly kind of confused. Had I not explained the facts clearly enough? What if I just say it, the same thing, but maybe with some slightly different phrasing? And then all of a sudden, a woman's voice rose from the back. She spoke sharply and forcefully, and it stopped everyone else from talking. Why is this outbreak only happening here in the Bronx? Why is it always happening here? Why is it always in our community? She wanted to know. I felt the power just rush out of my suit. It was now constricting me. My palms were sweating. My black leather shoes were weighing me down. I had not come prepared to answer that question. And when I get flustered, I don't really stop to think. I don't really stop to listen. I just talk. And I talk some more. And so I kept repeating, the air is safe. The water is safe to drink. Because those were the facts. But for some reason in my mind, I couldn't figure out why the facts weren't quelling everyone's anger. And that's the moment that stays with me. The moment I realize that the facts in public health are never enough. By the time I got to that town hall, I was, confident that we had found and cleaned the likely source of this outbreak. It was a cooling tower on top of a boutique hotel that had been newly constructed and sat in the middle of this neighborhood where people were sick. So when I said the air was safe, that was true. I believed it, and in fact, it was true. But what they heard me say was something very different. They heard government saying, just calm down. No need for you all to get worked up. We got it taken care of. They heard a system that had failed to protect them for a long time in the past. And now we were asking them to trust us. And that this time was somehow different than all of the times in the past. They heard the long history of neglect that had shaped their daily lives long before anybody in that neighborhood had gotten sick from this outbreak. So, in this community where chronic disease and environmental pollution, violence, racism, are fixtures of their daily lives, this outbreak felt like yet another insult, yet another unfair and unnecessary injury. Why does this always happen here? Why is our neighborhood the one that always suffers? Why should we believe you now? I had come there to talk about pathogens and probabilities. That's what I've been trained to do. They came to talk about, fairness and dignity. They wanted to know whether their lives truly counted as much as everyone else's in the city. And I realized I had walked into that room thinking my job was to lower people's fear by explaining risk. What I had not understood until that night was that my job was to listen and to feel their outrage and to connect with them on an emotional level. The anger in that room was not fundamentally about risks or the facts of this outbreak. It was about the relationship between the city government and this community. And they were outraged at the way they had been treated in this relationship. Outrage, as I now understand better, is shaped as much by history as it is by the acute hazards those of us who work on infectious diseases are fighting every day. Communities react to these threats based on the stress that they already carry with them, the inequities that they endure daily, and the way institutions have treated them long before anybody is getting sick in an outbreak. So, what I learned that night is actually simple, but it's often overlooked in our public health training. If you want people to trust you in a crisis, you need to get to know them before the crisis itself. As public health officials, we have to stop focusing only on our technical excellence. We must focus on our relationships with people and with communities. And if we wait until an outbreak to learn how people live, to learn what they love, to learn what they fear, and to learn how government has failed them in the past, then we're going to be speaking past them when we need them most to be speaking with them. So that was the night that I learned that in public health, relationships always come first and the facts come second. Thank you.